Primary care and cancer matters. Primary care increasingly is seeing cancer at all stages, so we're interested in addressing prevention and in particular early diagnosis. So recently the NHS long-term plan has been produced and it, amongst many other things, has set a target of 75% of all cancer cases to be diagnosed at an early stage by 2028. The reason for this is that early diagnosis is the biggest single factor in improving outcomes from cancer. Although early diagnosis is happening more often and rates have been improving over the last few years, if we are to achieve this by 2028, it will require new effort to address early diagnosis, and this will largely fall to primary care and the diagnostic pathways. What we know is that survival rates from early stage diagnosis are way better. So for example, the data in England shows that if diagnosis of lung cancer can be achieved at an early stage, 8 out of 10 will survive at least 1 year. And the opposite, if they are diagnosed at stage 4, only 2 out of those 10 will survive the year. We see a similar phenomenon with bowel cancer, with 9 out of 10 surviving a year when diagnosed early, but if the diagnosis is at a late stage, then only 4 out of 10 reach that target. We do see similar numbers across Wales, Northern Ireland and Scotland as well. One of the leading roles of primary care in the area of cancer is to achieve early diagnosis wherever that is possible, because this will result in decreased mortality and increased survival rates. We know that the reasons for late diagnosis are many and varied. These involve tumour factors, so for example pancreatic cancer and ovarian cancer are notoriously difficult to diagnose because they often will not present until they are at a later stage. There are person factors, so that we know that some people are quite reticent to come forward. There are system factors where there are failings, maybe in safety netting. There are diagnostic issues, particularly now with capacity being at pretty much at a full level. But importantly, in this context, primary care issues do come to the fore as well. And in addition, there are some secondary care issues. But in the primary care arena, it is an issue of picking up on symptom clusters and making the referral at the right time to the right place. There are a fantastic wealth of resources which we would like to point in your direction. We have the RCGP online learning toolkits, which have a fantastic resource to help you deepen and broaden your knowledge of cancer matters. We have the Cancer Research UK website, which again has a wealth of information, very user-friendly and very easy to get on top of. We also have Gateway C, which is increasingly available across the country. Fantastic resource which looks at case scenarios and allows you to think through how you would deal with those cases. And finally, doctors.net have a fantastic facility where they've worked in collaboration with CRUK to develop some really interesting education tools. So we would like to point you in the direction of the Health Professional Resources webpage at Cancer Research UK. We also have a network of health professional facilitators across the country, and they are able to arrange a practice visit, and they can pretty much field any query you have about cancer matters. They are particularly good at allowing practices to unpack their cancer data to see where they're doing well and where there may be room for improvement.